Shredanatkar. I'm a physical therapist who treats kids with neurodevelopmental disorders, genetic disorders, and a few other conditions. And I'm here to explain and elaborate on a lot of queries that I do get in my Instagram DMs. And I thought this would be a lot easier to reach out to more parents because I get a lot of common ones, a lot of common doubts, and I thought this is an easier way to completely sit back and elaborate all the queries one by one and help out and reach out to more parents if possible. Okay. So one of the most common one that I do get is it normal or is it okay if my toddler is still walking? Okay, so a lot of parents do ask me like, we don't know when to get it checked, like how long should we wait. A lot of times they're being told like, you can wait it out, let's just see, it's just a phase, they're gonna grow out of it. So a lot of the times either the parents wait out for too long when there is an underlying issue, and that makes us lose a lot of time for the child, or there is the end of the spectrum where parents are so anxious that okay, we don't want to wait, we need it to be fixed, we don't know if it's right, if it's wrong, if it's a problem, there is like, why is this happening? Okay, so I'm here to help you out and hopefully guide you and navigate you as to when to reach for a consultation, or when to get a physical therapist's evaluation, an OT evaluation, so that we can discuss and reach a point. Okay, so what is toe walking? Okay, so it's basically like what the name says, that your child is going on the tippy toes, the heels are not touching down when the child is walking, and even if you try hard or when you tell your child, still is not able to put the heel down. Okay, so when is it a problem? So what we look for is a lot of signs that we call as red flags. As when those are present, for sure we know there is an underlying issue which needs to be addressed. Okay, and if those red flags are present, which I'm gonna list out now, I would recommend that for sure you go and get a pediatric, get a consultation and evaluation done from your pediatrician, and even with your physical therapist, and in one more situation, even your occupational therapist. Okay, so let's go to the red flags. Okay, the first and foremost is, what is the age of your toddler when they are starting to do the toe walking? Okay, so why the age matters is because normally, like ideally, the kids start walking from between 12 months to 18 months. Okay, so once they start learning how to walk, they in between they start going on the toes and then back down again, up on the toes and down. So this can happen the toe walking is very inconsistent because they are trying to still figure out the walking pattern, they're figuring out their gait, and sometimes they are playing, and that's when the heels come up and they go on the tippy toes, or sometimes they are doing it out of curiosity, trying to figure out different textures, different surfaces, which makes them do that. But so if you see this very inconsistently, it's not that always my child is on toes, then it's okay. That's when you start waiting out and trying to see. But so the wait out period is always 3 to 6 months. I would not recommend going beyond that, because beyond that we need to still address like, why is my child still not okay putting the heels down? Okay, so the age matters. Why is because see, a lot of times when I get kids with neurodevelopmental disorders, they might be at the age of 2 or sometimes earlier, but when they come and when they start realizing that okay, my child has been walking since 12 months of age, but right now it's 2 years and still has not stopped toe walking, and the toe walking is consistent toe walking. Okay, that time it's an issue. We need to start looking for why is this happening, what is the root cause of the problem. Okay, so the age matters is like from from the time my child started walking, which should be ideally 12 to 18 months, and from there between 3 to 6 months, if there is no underlying neurological disorder or genetic disorder which has been diagnosed, then 3 to 6 months that you can wait and you can see. If the child is still doing that, then you need to get it checked for sure. Okay, it's better to get it checked, better to get the evaluation done as early as possible, because once you start that early, and if there is a problem, it can be addressed faster. Okay, the treatment can be started early, and that's the whole concept behind early intervention, and it's important because the earlier we start, the better the chances of getting good results for the child, as the child's brain is still developing. Okay, so that is the age, and you have to see how frequently is your child walking on the toes. The second one is when you start seeing along with toe walking there is a speech delay. My child doesn't make an eye contact, there's lack of eye contact, or they're starting to have sensory issues, starting to avoid certain textures and getting very uncomfortable with certain clothing, and while walking on certain surfaces, then it needs to be looked at. And this is a situation where I said that you might even need an occupational therapist evaluation to understand if there are any sensory issues because of which the child is having a delay. Okay, and along with that, is that the reason why the child is going on tippy toes? The third one that you look for is if there is any stiffness in the calves that you feel. So a lot of times you might even feel stiffness in one leg. If there is any underlying neurological issue, you might see the stiffness only in one leg or one hand, or sometimes you can feel it in both the legs. So this is one of the practices in India that every kid goes through an oil massage before taking them for a bath. So during that oil massage, parents frequently get to know if there is any stiffness in the calves or stiffness in the around the legs. So this is something that you look for, and this helps you to understand if there is an underlying issue. Okay, so look for if there is any stiffness in the calf. Just try to feel the child's legs, and if you do feel any stiffness, you get it checked as to why is this happening, because in toddlers it should not happen. Okay. The fourth one is something that has been seen more recently, is if there is any regression in the milestones following an incident, like a fall or following an infection. So if your child had an infection or a fever for a few days, and following that he not walking, not going, starting to go on tippy toes, not rolling, or starting to have a decline in the milestones, or losing speech, you should get it checked. Or if there was an injury and following that the child started going on tippy toes, you should get it checked. Okay, in such situations we need to find the root cause so that it can be dealt with faster. Okay, so the fifth one, to be honest, it's not really like a red flag. Okay, so technically there are 4 red flags. Fifth one is more like an observation, and over time the researchers also have shown this, is if your child was put in the walkers, do not put your child in those walkers to make them walk. I know that it gives a lot of freedom, and you start seeing that the child who could not stand and do anything is starting to like go run around, explore the place and everything. But that is one of the main reasons that we see these days why the child is going on tippy toes. Okay, a lot of times in the walkers, they only the toes touch down, and it's easier because they're suspended. They start going on toes, and that makes them go into a lot of toe walking. Okay, so avoid like 100% avoid putting a child through the walkers. If the child is taking longer to stand and walk, it's still okay than going on the tippy toes and causing more harm than benefits, for sure. Okay, I think that's all. I think, yeah, That's all. Those are the red flags. That is what you look for. If you have any more questions, please do drop in my comments section, or you can reach out to me on my Instagram called saidblocare, and you can just DM me if you want to send it personally. And I'm hoping to do more and more of these so that I can help out and reach out more parents out there.